Let's further discuss this now with Dr. Angelique Coetzee. She is the former chairperson for the South Africa Medical Association and a medical clinician. Thank you so much for being with us, Doctor, on the program. We often hear about cholera outbreaks across the African continent. Before we get into the significance, of course, of this development, give us some insight and some context into how serious of a sickness cholera is across Africa.
Thank you, and it's great to be here. So, if you look at cholera, it still remains one of Africa's most persistent public health challenges that we see. So, in the last 2 years alone, the World Health Organization recorded over about 400,000 cases and more than 7,000 deaths across our continent. We still see outbreaks, in places like Malawi, Mozambique, Zambia, and South Sudan. Most of the times this will happen after flooding or when the water systems break down. So cholera is just not a disease. It's really also a mirror of what we see in inequality. It shows where people still lack access to clean water and sanitation. So it's a huge problem in Africa.
Doctor, I remember speaking to you during the COVID-19 pandemic on why not enough vaccines weren't being sent to the African continent. It is groundbreaking to see a vaccine for cholera being manufactured now in Africa. But of course, we can't ignore the criticism the international community has received for not providing vaccines for Africa.
Yes, it's true. So that's the tough part. So Africa uses about a quarter of all the world's vaccines, but we make less than 1%. So we have been dependent for decades on imports from India and Europe because the vaccine manufacturing needs huge investments and very strict quality controls and highly skilled workforces. So during the pandemic, it actually woke us up. We saw that when the borders were closed, we couldn't get these dosages. So Africa finally building its own capacity in places like South Africa, Senegal, Egypt, and Rwanda. So COVID-19 was actually our wake-up call. We realized we cannot always depend on others to protect our people. And it's very difficult for Africa to make its own vaccines because part of it is history. After independence, the focus was more on treating diseases, not producing medicines, and partly economics. So it is cheaper in the short term to rather import than invest in factories. But the local production gives long-term benefits, especially in South Africa. So it's jobs creating, it's faster access in outbreaks, price stability. It's like the minister said, it's not just about mixing chemicals. It is about the technology, the policy, and the political will to work together. So yes, it is extremely important.
Okay, Dr. Angelique Coetzee, thank you so much for being with us here on the NewsHour and sharing that insight with us.